Tutumoni Baishya of Telemedicine Coordinator. I will today present you what is about KTC and our services during the COVID-19, second wave of COVID-19. First, how we register the cancer patient at KTC. As we know, Dr. Bikuldas as an oncologist, so local patients of Hazu and Swampisi area, they contact to KTC first. We then registered in our registered book. Then we collect all the original documents they have gone through during their diagnosis process. After that, we ask them to tell us their history of during their diagnosis. Also, we advise them to explain us what the suffering they are going through, their present condition and all, and also their symptoms during the diagnosis. Here I have attached the two photos. One is our clinical officer Ritika, who is explaining to our breast cancer survivor Tutumoni Baishya about their disease of diagnosis. We explain to them their stages, their disease and all, what the process, what the treatment may be also, all that. And second picture, it's me and the two cancer patients. One is breast cancer and another one is esophageal cancer. Here I am taking their history. Their present symptoms and all, their suffering going through, and also their previous history during their diagnosis. Next, what we do with the cancer patient at KTC. After the patient visit to KTC, we check their hemoglobin, BP, and also weight. We evaluate the original documents that they have given to us during their visit and prepare one summary report. And after that, we send that report to Dr. Bikuldas. After that, Dr. Bikuldas and our KTC team discuss the case. And after that, on Saturday, sir provide the suggestion to the cancer patient. Here I have attached one photo where our KTC team, Rupam, is checking the BP, weight and hemoglobin of the cancer patients during their visit to KTC. Second one is physical evaluation of the cancer patient. This is one was the ovarian cancer, and Dr. Bikuldas is evaluating the cancer patient. Third one is Dr. Bikuldas and our KTC team discussing the case with the cancer patient. Third, now we are doing the virtual counselling also to the cancer patient. We daily follow up to the cancer patient who are needed and who are needed for weekly and who are needed for daily. Some of the cancer patients are require palliative care also. So we provide services to the palliative care of the cancer patient also. We also communicate with the concerned doctors of the BPCI and also to the oncologists. And we also advise the cancer patients during their follow-up to visit to KTC for our focus group discussion for counseling, and also advise them to share their pain and suffering to us, or if they face any difficulties during their visit to hospital. These are virtual counseling we are doing. One is the oral cancer patients, and this is our KTC team. And second one is the osteosarcoma. He is only 10 years old boy, and others are our KTC team with Dr. Bikuldas. Third one is we also give home visit to the cancer patient. We provide during their home visit to the cancer patient, we also check their hemoglobin, weight and BP, because many of the cancer patients during their treatment process, they could not visit to KTC. So we provide their home care services, and also we check their way of living, their hygienity, and also we provide their mental and support to the family and to the patients also. Here I have attached 3 pictures. One is with Dr. Bikuldas, home visit to the cancer patients, Runumi Mahanta during this time visit, and other one is ovarian cancer KTC team, and another one is also osteosarcoma. This one week has been recently done surgery. Third one is contribution of contribution of cancer patients in cancer research. As we know, many of the cancer patients during the treatment process, they have to go through many tests and all, diagnosis tests and all. So it is very expensive also. So what we do, and it is very expensive in the lab. So what we do during their home visit, we collect some of the cancer patients, their samples, suppose oral saliva, oral swab, and also blood. And we do we perform the test in our Kavi laboratory and evaluate it. After that, we discuss that report with our KTC, and also we discuss that report to the concerned doctors they are going through it. Here, I think we have Partner is taking sample to the oral cancer patients, and another one is Partner and another team members of KTC Tokonda during this oral cancer patient, and this is during the COVID-19, first wave of COVID-19 visit. Third one is what we do also is focus group discussion among the cancer patients. We arrange focus group discussion among the cancer patients. The cancer patient and the attendants, they always interact with us only, KTC members and all. So we arrange the focus group discussion so that they can communicate with their other cancer patients also. So during their interactions, they share their problems, they share their sufferings they are going through, and also they share their knowledge and motivations that they are going through it. One is the focus group discussion with Dr. Bikul Das, and we have arranged one focus group discussion also with the oral cancer patients. As you know, KTC provides services to the cancer patients, now to the non-cancer patients also, and also to the TB, and also we thought of providing services to the second wave of COVID-19 also. So how we have arranged, how we have provided the service to the second wave of COVID-19 by KTC, I will explain now. Next, how we reach out to the COVID-19 patients at that time. First, we have developed a home care plan with ICMR guideline. Then we prepared the pamphlet, and after that we distributed through WhatsApps, through local newspaper pamphlet, through local newspapers, through WhatsApps and social media. After that, we also have prepared one local language COVID-19 book from Khanan. Then we connect to the local school, colleges, then local hospitals and local hospitals also to connect with us during the COVID-19 also. In this way, we have connected more than 30 plus volunteers during the COVID-19, and they have been working with us till now also. I have attached here the pamphlet that we have shared during the COVID-19, and also the local COVID-19 book from Khala during the COVID-19 in local languages. Then how we evaluate the COVID-19 patients. After we reach out to the COVID-19 patients, our daily monitoring is to check their SpO2, their breath holding test, their respiration rate, their temperature. If sometimes required, we refer to the COVID-19 local hospitals also. Then we daily analyze the COVID-19 patients based on their diagnosis of COVID-19, means their symptoms during the COVID-19. And we daily monitor their SpO2, BHT, means breath holding test, respiration test through telephonic only. And it helps us by the volunteers and also with our KTC team also. Here I have attached the photo during the COVID-19 where the KTC team, one of our COVID positive patients, her SpO2 was 72, and we advised to do Nicoda yoga, and we evaluate through the telephonic only, the video call. Then Lekika and me was evaluating them again. I have attached pulse oximeter reading of the COVID-19 patient, that was by Lekika and me. And third, I have evaluated one of our COVID-19 patients performing steam inhalations. These are COVID-19 patients, and other one is the KTC team that we are engaged in COVID-19. Third is how we took care of the COVID-19 patients. We have already managed the COVID-19 patients through Nigoda Yoga home care plan. That we advise the COVID-19 patients to do Nigoda Yoga pulse oximeter test 3 times daily, that is for half an hour, 3 times daily. Then we also advise them to do steam inhalations, betadine gargle, then cough syrup when required, and also advise to do food nutritions. We observe the patients till the 4 weeks, so that we analyze their symptoms, evaluate their symptoms, and also till their recovery of the patients. Third, we also observed the COVID-19, post-COVID-19 patients also after they're returning from their hospitals till their recovery. Because many of the post-COVID-19 patients have their symptoms till their visit to the home. We have reached out to that patients also and recovered them. So in that process, we have reached to the 1,500 COVID-19 positive patients during COVID of Hajwan Salgas area. Third is, what are the services we provided in the COVID-19 patients? We provide pulse oximeter also to the COVID-19 patients. We have distributed pamphlets. We have distributed booklet also to the local schools and colleges. We have also done blood tests also, CBC and CRP, to check their inflammations during when we are evaluating that patient. One patient, when we are evaluating him, we also check their BPs and BP and CRP in that process. And also we provide Nigoda yoga training also by our volunteers. Here I have attached one patient during the COVID-19 where Rupam is giving oxygen cylinder. And after that, he only contact to the local hospitals so that they can take him to the hospitals also, admit. And third one is collecting of blood samples from the COVID-19 patients. And third, here are two photos I have attached where Nigoda yoga training is given to the local schools, colleges, and also to the hospitals. Third one is other distribution also we have provided, means COVID-19 books to the local PHCs and local peoples also, what I have said. And also we have distributed medicines also during COVID-19 because many of the patients have not recovered their cough, not recovered their fever also. So we have reached out to them and distributed medicines. Here I think you have seen what I have attached photos here during the COVID-19. Also I have to say that we during the COVID-19, our team members, this Rupams and Soilenda and other team member Partha also engaged in the two hospitals also, local hospitals, that nearby local hospital. They work in that during the COVID-19. They work in both the hospitals also. Here I have given that how KTC is related to KKL, means Kavi Krishna Lab. As we know that the patients when first visited to KTC, we take their consent during consent in the consent forms if we want their samples during our research. Then we because through KTC we get more connected to the cancer patients so that we know more their pains and sufferings they are going through. And as KTC is based on IKS, Indian knowledge system, so during the focus group discussions and other, they share their knowledge. So after getting more knowledge and more knowledge among themselves, they can reduce their pain and sufferings. These are our teams. Thank you. Question?
No questions? Just give one appreciation line.
It was really good to know how you people helped the DD1 during COVID-19. Like in a situation that people were so afraid to even talk to the people who are suffering, you guys went out and reached them and helped them. So it was really nice to know.
Yeah, and
I really like the idea of the community because at that time we are like mentally and emotionally unstable, so it's really good to know sometimes even if the hopes are good, but still being there is a very good cause.
Certain patients, as Ma'am told about that, there has been not prescribed any medicine or any treatment, that they are told to do some yoga, like Nigoda yoga or something. Like how it is done and how it is helping in for those patients.
Yeah, Nigoda yoga test dressing. I think 3 steps are not there, but still. Yeah, that plays on it. Just previous one, where the pictures are put. the Nigoda yoga pictures, but done by the students.
Oh, sorry.
Yeah. Okay. So here, like, all the steps are not shown, but anyway, I can show you, which is in our lab also. We have put it as a picture in a board. So Nigoda. Nigoda means the microscopic organism. I told some of you, I guess. Yeah. So Nigoda means the microscopic organism, and it's originated from Jain or Sanskrit those days. So that means microscopic organism, you know what are the microscopic organisms, the microorganisms and everything. So why we call it Nigoda Yoga? Because at that the paper you read, that you have published in biology, where I told that good Nigoda and bad Nigoda. Okay, so I would explain it again, or I can explain it in the lab. But the main point is like the good Nigoda, which is the antigen or the antibody of the virus or the bacteria, which we call good Nigoda, and the pathogen, which in fact that is bad Nigoda. Okay. So Nigoda Yoga, during Nigoda Yoga, we think that we propose that this the good Nigoda inside for the antigen of the virus or the Covid-19 or any lung diseases which cause infection in lung. So that good Nigoda, it is already inside our body. During this yoga, it comes up. It spread and it provides a herd immunity among the community. Okay, first thing is that's why it is Nigoda Yoga, and it contains mainly 3 steps. One is that we do breath holding test, we do breath holding for how much time you can hold your breath. That during that is kind of a breathing yoga. Okay, that's breathing yoga. Then one we call that is pranayam, right? Breathing yoga is the pranayam only, and then we had a Kumbhoka. Okay. So then, starting with pranayam and this, right? Yeah. So then one is like mandala pada. That is the work. Okay. When you just round and round, you complete a work of 6 rounds. So then it comes that Havahan, Kamrupi Havahan, that is the prone position when you do that. So what we did actually, we followed the Islamic protocol, definitely that medicine is there, but along with for lung reoxygenation, we suggested them to do the Nigoda Yoga. And it extremely helped, because when they do that Kumbhaka, okay, after that we counted their oxygen level. So then it's little less or it's just normal. Then when they go for work, oxygen level goes down. Even if you check with you also, you will get it, right? So after that, when the oxygen level goes down, then we ask them to do the prone position, and then oxygen level increases. Because even if you do ventilation or the artificial oxygenation, that just provide oxygen artificially. That doesn't increase your lung reoxygenation capacity. Okay. During Covid-19, that's the problem happened with most of the patients in the hospital. All were in panic. Whenever if you walk, if you have a fever or cough, your oxygen will go down. But whenever it was like below 92 or it's around even 95, 94, they put the artificial ventilation or artificial oxygen. And once the oxygen is provided artificially, their reoxygenation capacity actually goes down only. So that one lady, Sobita Das, she was in the hospital. She was provided with that oxygen cylinder, and it never increased. But we secretly, with the help of another hospital patient who actually helped a lot, he secretly connected with us, with her. In video call, we suggested her to keep on doing this. So she stayed there for 7 days, but her oxygen did not increase. But then after 7 days, when her inflammation was in control, we tested the CRP and everything, when the inflammation was in control, she just forcefully came out of the hospital. That time also her oxygen level was just 75, but it then increased. Okay, so you understand now? So that way it works, and most of the time during COVID there, in National Health Mission released one pamphlet, everyone can buy these medicines and have it. Those ivermectin and those kind of stuff they have, yeah. So, but all of them do not suffer from the same symptoms. They do not need to eat all of them. Most of the patients who have taken ivermectin, which is a parasite, anti-parasites. So what happened to them? They started having vomiting and now hemoglobin went low. They do not know what happened. Then we just stopped them. We just asked them to stop the medicine and they recovered. So in that way, obviously the ICMR protocol we followed, but we followed the common sense as well. So then our volunteers also they did a brilliant job. During that time they visited many of them. They cannot come out. Most of the patients also did, because of fear that hospital will pick them up, they did not inform also. So that's why they have over the phone, over the video call, we have distributed pamphlet via the newspaper and then they call us. Most of them who were afraid and sitting at home, then they started calling us and then we reached out to them. So even below, we have prevented the progression to stage 3 disease. We have we have just stopped the disease at stage 2. I think more than 120 patients who were in stage 2. That is 89 to 93. We did not allow them to go to hospital. They did not want to as well. So we managed them at home. So that's the and the steam inhalation. You know how it helps? You do autoclaving? What is it? It's just steam. It's just the temperature, right? It's sterilized. When you take the steam, it just sterilizes. It just kill inactive your virus particles, bacterial particles. These are the traditional methods people now forget, but we ask them to do it properly, and they did. We made it available in the YouTube, and everyone followed via that. And also another thing is what is that? The nutrition. People has the habit of getting recovered when they have the ORS, saline sometimes. So, but actually the best nutrition is the lentil soup. Lentil soup is the best. The doctor cannot give it because doctor will not get anything out of the lentil soup, no? So we just so lentil soup has the best nutrition and the boiling. We asked him to do it and then it worked. Got it? Great. Done. Okay. Chalo. Anything you want to know more? And Tutumoni Baishya, we told it, she is the breast cancer survivor who is sitting here. So her picture is there. To many of them, all are, she was the one who had that little virus mode, so she is still with us. Most of them are with us, but not as that. They're still, sometimes they're hesitant.